Gilteritinib, also known as Xospata, is a medication used to treat a type of cancer called acute myeloid leukemia, AML. It works by slowing down or stopping the growth of cancer cells in the body. This medication is taken orally, usually once a day with or without food. It's important to take Xospata at the same time every day to get the most benefit from it. If you have any questions about the best time to take this medication, be sure to ask your doctor or pharmacist for guidance. Before starting Xospata, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Swallow the tablets whole. Do not crush, chew, or split the tablets. The dosage is based on your medical condition and response to treatment. Do not increase your dose or take this drug more often or for longer than prescribed. Use this medication regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. Some common side effects of Xospata may include tiredness, constipation, nausea/vomiting, diarrhea, mouth sores, decreased appetite, changes in taste, headache, trouble sleeping, or muscle/joint pain. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to monitor your blood pressure regularly as this medication may raise it. Contact your doctor immediately if you experience any serious side effects such as ongoing nausea/vomiting, stomach/abdominal pain, vision changes, or mental/mood changes. In the case of a very serious allergic reaction, seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed, be sure to contact your doctor or pharmacist. If you're taking Xospata, it's important to be aware of a serious condition called differentiation syndrome. If you experience symptoms such as fever, cough, trouble breathing, rapid weight gain, swelling in your arms or legs, changes in urination, or dizziness, seek medical help right away. This condition can be rare, but it's important to be aware of the signs and seek help if you experience any of them. As always, if you have any concerns or questions about your medication, be sure to talk to your doctor. And remember to take Xospata exactly as prescribed by your healthcare provider. Before taking Xospata, make sure to inform your doctor of any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's important to also discuss your medical history with your doctor before using Xospata. Xospata may affect the rhythm of your heart, causing a condition known as QT prolongation. This can lead to serious symptoms that require immediate medical attention. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. It's important to inform your doctor of all the drugs you take and any existing heart problems. Low levels of potassium or magnesium in the blood may also increase the risk of QT prolongation. It's important to talk to your doctor about using Xospata safely, especially if you have conditions such as severe sweating, diarrhea, or vomiting. This medication may cause dizziness, and the use of alcohol or marijuana can intensify this effect. It's important to avoid driving or using machinery until you are sure you can do so safely. Limiting alcoholic beverages and discussing the use of marijuana with your doctor is recommended. If you are planning to have surgery, make sure to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to discuss pregnancy and birth control with your doctor before using Xospata. This medication can harm an unborn baby, so reliable forms of birth control should be used during treatment and for a certain period of time after the last dose. If you or your partner become pregnant, it's important to talk to your doctor about the risks and benefits of this medication. It is not recommended to breastfeed while using this medication and for a certain period of time after stopping it, as it is unknown if Xospata passes into breast milk and may pose a risk to the infant. Consult your doctor before breastfeeding. It's important to be aware that Xospata can interact with other medications, potentially affecting how it works or increasing the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor first. Certain medications, such as itraconazole and rifamycins, can impact the removal of Xospata from your body, potentially affecting its effectiveness. Be sure to discuss any potential interactions with your doctor or pharmacist. If you or someone you know has taken too much Xospata and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. It's important not to share Xospata with others. While taking this medication, you may need to undergo lab and/or medical tests to monitor your kidney/liver function and blood mineral levels. Be sure to keep all medical and lab appointments. If you forget to take a dose of Xospata, take it as soon as you remember. However, if it's within 12 hours of your next scheduled dose, then just skip the missed dose and take the next dose at your usual time. Do not take a double dose to make up for the missed one. It's important to keep Xospata in the container provided by your pharmacist at room temperature, away from light and moisture. Don't store it in a different container or in the bathroom. Keep all medications away from children and pets. When you no longer need Xospata or it is expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.